Hamstring injuries are known to be one of the most common injuries in sports. The main cause of hamstring strains usually come from a high rate of sprinting, jumping, or kicking. Sports such as soccer, AFL, rugby, or NFL require high rates of these movements, making them most vulnerable to hamstring strains. So, why are hamstrings so easy to injure for these athletes? Do the athletes that obtain these injuries have a lack of strength, poor technique, or is it just by having minimal flexibility? Due to so many factors potentially influencing a prone area, it is very important for coaches and athletes to better understand the anatomy of the hamstrings, the preventions, the causes, as well as the immediate and long-term rehabilitation methods. This knowledge is also very valuable if the athlete has previously injured the hamstring in the past, as according to the Journal of Sport and Health Science, that in the English professional football season, 11% of total injuries sustained in preseason trainings and 12% of total injuries occurred on field are hamstring strains. This number leads to a total of 13,116 days and 2,029 matches missed per season. This hamstring strain also recurred in between 12% and 48% of these English football players. So before delving into the specifics of hamstring strains, we need to take a brief look at the anatomy of the hamstring. There are three primary polyarticular muscles called the bicep femoris, semitendinosus, and semimembranosus. The semitendinosus and semimembranosus attach to the medial side of the tibia, so they are in control of your medial rotation, whilst the bicep femoris is attached laterally on the head of the fibula, which means it helps your lateral rotation. All three muscles originate at the ischium and attach to the tibia and fibula just below the knee. They all work together in extending the hip and flexing the knee. Hamstring strains come in three different grades. A grade 1 strain causes mild pain with a small tear and little to no loss of muscular strength. A grade 2 strain inflicts moderate pain with more significant tearing and a noticeable loss in muscular strength. Lastly, a grade 3 strain is the most severe strain with a complete tear across the whole muscle, as well as a loss of functionality to the muscle. The athletes that obtain hamstring strains usually have some risk factors that are not being properly treated. These causes of hamstring strains can be separated into two categories: primary and secondary. The primary risk factor for hamstring strains can be labeled as intrinsic injuries, since primary hamstring strains occur during the eccentric loading phase of the muscles. These intrinsic hamstring injuries most likely will occur when the athlete has poor technique, lacks a warm-up, overloads the hamstring, or has prior tightness in the muscle. Secondary hamstring strains come across when the primary injury was mismanaged. For example, if the athlete returns to training too quickly without letting the muscle properly recover, will result in a high chance of re-injury. Re-injury of a hamstring strain is very common amongst professional athletes since they have minimal rest post-injury. A study was done by the Journal of Sport and Health Science stating that 34% of Australian footballers re-injured their hamstring muscle within a year of returning to play. To see what a hamstring strain looks like in action, I've got this video showing Giancarlo Stanton from the Miami Marlins suffering the injury whilst running to first base.
Breaking ball, little dribbler. Buck goes to first, and Stanton is hurt. Down goes Stanton. Oh, goodness. In a season, Stanton finally finds his groove over this past week. The home runs start to come, and down he goes. Wow.
Watching it in full speed for the first time does not look like much, but when it is replayed with the front-on view, you can see that Stanton plants his foot onto first base awkwardly and that is all that is needed for the hamstring to buckle. The immediate physiological effects of a hamstring strain is for the athlete to feel an acute, sharp pain at the back of the thigh, causing the athlete to abruptly stop. They may also experience swelling and bruising at the site. Immediate treatment to a hamstring injury usually goes through the RISA protocol: rest, ice, compression, elevation, and refer. The RISA method is used to reduce bleeding and damage in the muscle tissue. Resting is always key, even if it is a grade 1 tear, as the strain can easily get damaged further if the athlete continues. The general resting rule guideline is to rest grade 1 strains for 3 weeks, grade 2 for 4 to 6 weeks. Case of a grade 3, also known as a complete rupture, the hamstring will have to be surgically repaired with 3 months of rest after that. The odds of re-injuring the hamstring are very high, as a rehabilitation process is usually done poorly. It is recommended to get into a physiotherapist as soon as possible, as their treatment aims to reduce pain, regain range of motion, strengthen and stabilize the muscles surrounding the hamstring, as well as minimizing the chance of re-injury. It is also highly ideal to do some rehabilitation exercises in your own time. I have got my guys from Running Physio to create a short video of hamstring rehab exercises you can do at the gym. I've also included a sheet in my booklet showing 8 hamstring exercises you can do at home.
The Nordic curl. What you'll notice with this exercise is the emphasis is very strongly on the eccentric component, lowering the body down and then using the arms and bending the knees to make the concentric component easier. Next up we have the supine leg curl, pushing the skateboard away from the body and then bringing it back towards the body and controlling that lengthening of the hamstrings again. Nice option is to do it in your teams and get them working together, building their hamstring strength. As a progression, you can move on to single leg, which is a lot tougher. And once again, you can make the concentric component easier by doing the eccentric on one leg and the concentric with both legs. And finally, we have the sprinter leg curl, which does actually replicate that running gait cycle a little bit, trying to emphasize on control.
As an aspiring professional athlete or a social player, please do take the time before and after your exercises or sports to adequately warm up and cool down to minimize the risk of niggly and lengthy injuries.